Starting in 2026, some Medicare patients will have a new gatekeeper for certain treatments: AI. AI will help decide what gets approved. Hi, my name is Ryan Flynn, and I write about AI and how it's impacting healthcare in my AIRX newsletter on Substack. Here's some news that's going to affect some people soon, so I thought I'd share it. On January 1st, 2026, Medicare starts a test program in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. It runs for 6 years and it focuses on 17 types of services that Medicare says are often overused or risky if done the wrong way. Doctors in these states will need special approval before doing some of these procedures for patients on original Medicare. That extra step is called prior authorization, which means Medicare wants to review certain treatments in advance before it agrees to pay for it. Here are the few areas and examples that the kind of care that will be reviewed. So, shots in the spine for chronic back pain, called epidural steroid injections; bone cement procedures, where doctors inject cement into cracked spinal bones to relieve pain; small devices that send electrical signals to nerves, used for things like bladder control problems, sleep apnea, or movement disorders such as Parkinson's disease; and some types of knee cleanup surgeries for arthritis, where a scope is used to wash out or shave the joint. Medicare argues that these services can help some people, but they're also used in cases where the benefit is unclear or where safer options might exist. That's why they're testing this new AI system on these. To run this program, Medicare is hiring tech companies that have already helped private insurers handle approvals. Their software will scan requests from doctors, look for patterns that suggest a treatment might not meet Medicare's rules, and then flag those cases for closer review. A human medical reviewer still has to sign off on any denial. So think of AI as a fast filter that sorts through the easy yes and easy no cases while people handle the tougher calls. If you're on Medicare in one of those 6 states and your doctor recommends one of those procedures, you may face an extra approval step. That can mean more paperwork for your doctor and some waiting time before you can get the treatment. Supporters say this can cut down on risky or low value care and save money in the system. Critics always worry that it can make it harder for some patients, especially those with long-lasting pain or complex conditions, to get the care they need. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, and you're on Medicare, ask your doctor next year, 2026, whether a planned procedure needs special approval first. If a service is denied, ask who the reviewer is, how the decision was made, and what steps you can do to appeal it. If you want to see the source, search online for CMS Wiser model, and that's WISER, to read Medicare's own documents and slides about this program.